The reason why I choose to study medicine, my mother, she died when I was pretty young, so I think that because she wants me to be a doctor, so I think that I can follow her dream. But when I study in the medical school, I like it more and more because when I can help people, like make them get better from the disease, I feel like I'm very happy.
When I was a high school student, I was a person who really would like to try everything. And after I have experienced all of the career fields that I was interested in, I found that faculties of medicine the most attractive for me. I can see that there are a number of specialties and subspecialties for me to continue my career path afterwards.
It's going to be a long story. During my high school time, I had a strong interest in biology, human body, diseases, medical science, stuff like that. But I wasn't very convinced that I want to become a doctor. I had a very strong fear of needles, and a lot of things happened. Like there was one time I was on a plane back to Thailand. One passenger collapsed on the aisle next to me. And luckily there was a doctor on the plane and the gentleman was fine. But I felt if I had been in medicine, I would be able to do something for that person. I decided to come back to Thailand to study medicine. Okay, my name is Bill, and I'm a fourth year student at Siriraj Hospital, Mahidol University. I think the best thing about being a med student is to see myself going forward in certain direction that could be helpful to people.
I'm not Charles of the Soul, or you can call me Cashew. I'm the fourth year medical student studying at Faculties of Medicine, Siriraj Hospital. I like the community because all of our friends and seniors and juniors help each other to get us through our curriculum. I also really enjoy doing extracurricular activities, exercise, doing gym, playing basketball, swim. The preclinical schedule is quite certain. So preclinical students have more time to focus on extracurricular activities as well as their hobbies.
I love to draw pictures. So I try to merge that with my medical study. Like I drew a lot of diagrams for my friends, like medical diagram. And some of my friends found it very helpful, and I feel motivated in doing that. But I still have less free time. I don't know how. It's hard to say.
Before I entered, I have heard a lot of rumors that it is really intense. But after I really entered, I can feel that. I really admire all of my seniors and all doctors who have graduated from our faculty.
So it goes like this. I wake up in the morning. Usually I try to wake up as early as possible, sometimes 4 or 5 in the morning, to study before the lecture, because sometimes if you do not pre-read the subject, you get so lost in the lecture. Of course, there's a lot of information in the lecture, so I need to come back and review many of the times. And it's a cycle that repeats almost every day. So it's tired, but I think I am enjoying it.
For clinical students, I think we have to adapt a lot because we have to study and work in the hospital setting. We have to work with all the healthcare providers. We have to study and learn from our patients. At the same time, we also have to take care of patients. I really want to study on site. On this Friday and Thursday, I will also visit the ASCVD ward, the HIV ward, and geriatric ward.
Because I'm a fourth year student and I haven't had any clinical exposure before, so most of my time was my 3 years try to perform well in the exam. And because there's a lot of information, it's very crucial that you be able to pick what would be show up on the exam, and that I think that's challenging, and that's the kind of skill that you need to obtain as you progress through the med school.
Sometimes we also study in laboratory setting, such as histology subject and pathology subject. The most interesting for me is cadaver dissection in gross anatomy room. And after 6 years, we graduate and we are becoming an intern. The 6 year medical student is pretty like a doctor. And then we continue our specialties. Yeah, I think I want to be a surgeon. I'm not sure.
When I was a medical student, I had a rotation in the radiology department, and I think it was amazing to use something that sounds dangerous, but use it to cure the patient, to make them the healthier life. My name is Tanya, and I'm a radiologist, a doctor who works with the radiation. We use different kind of radiation. We can separate it as radiation for do the image and the radiation to do the treatment. And in my case, I am the nuclear medicine physician, so I use both. I do the radiation for imaging and both the treatment, like treating the cancer cell, we kill the cancer cell, or we use the radiation to destroy some tissue we don't want to be in the body. In my daily life as radiologist, sometimes I work in the clinic, like in thyroid clinic, because we use the radiation to treat the patient with thyroid disease, and we interact with the patient, give them the diagnosis and treat them with using the radiation. And sometimes, like here, I do the scan. When other doctors suspect some disease in the patient, they will send them to us to scan and check if there is any abnormality in the body, and we will we find out what is the abnormal in the body, and we will report and send the report back to the doctor. It's like we help each other like a team to make the correct diagnosis and lead to the correct management. I enjoyed very much because now the radiology field expand a lot. It is one of the field in the medicine with the most development, especially in the era of AI, artificial intelligence. We can use artificial intelligence in many steps. Like we use it for the quality control of the image. We use it to make the processing image get a better resolution. And we will use it like we train the machine to separate between the disease and the normal, and we also differentiate them into different kind of disease, so we can make it the diagnosis more accurately and more faster.
The two main technology that will transform the medicine is robotic and artificial intelligence. The robotic is like an arm of the surgeon, and AI is like a brain of the surgeon. It must combine together. In my opinion, it's not replace, but it will augment the skill of the surgeon, or let the surgeon have like a power to treat people more precise and more number. My name is Rattapon Tuong Thong. I'm a Deputy Dean in Student Affairs, Faculty of Medicine, Sirirat Hospital, Mahidol University. Do surgery for about 12 years in hair transplantation. The work that I do, it is very tedious work. I do operation for 6 to 8 hours, and it depend on surgeon skill. So robot should replace this field in the future. The medicine in the future first is more speed and more precise. I think the new curriculum is the answer for the future, the answer for creating the new innovation for the fast speed world. The new curriculum for the medical student, it will start this August. Medical student can learn not only medicine, they can learn combined with the engineering, ICT, or management, and public health. I think different skill is important to create innovation. If you learn just only medicine, your scope is focused on medicine. But if you learn more in the other field, you have like a different point of view. So it's easier for you to create new innovation. In my opinion, I think it's very important for medical students to have creativity skill. I think nowadays the world turn very quick at the new knowledge and knowledge management a lot. So you must have creativity to create new things because of the knowledge duplicate very quickly.
So I think that one thing you need to be active in learning. You should not just finish your life as the graduation and then stop it. You need to learn every new thing because medical science change very rapidly. And I think that learning the new thing make you feel alive. And one of the thing I like is because I'm instructor in a medical school, so when I get a new knowledge, I can train that into my to my student, and we will make more and more skillful doctors to help more and more patients.
For being a great medical student, there are like a lot of skills you need besides intellectual skills, which is very, very important for our like intense curriculum. I think time management skills is very important.
I think that it's hard to make good work and life balance or study and life balance, but you need to practice more about time management skill.
I think the skills you need in becoming a good medical student is to manage your time well. I think that's very important because we all have 24 hours a day, and like we need to study like 30 hours a day. So you need to pick what to study in your limited time. But you also have to spare some of your time to enjoy your life.
I like plan in advance what I would like to do in this month or in this year, and then I rearrange my schedule, and like I think this skill is very important and help us maintain our work-life balance.
And I think another thing is the interprofessional skill. Because you don't work alone, you need to work with the other doctors, nurses, technologists, and you need to have sympathy with the patient and also their relative. Some people say it is even more important than knowledge or medical skill. If you have this skill, you can survive.
The second one is the communication skills and interpersonal skills. Because like being a medical student or even a physician, you cannot work in isolation. You have to work with others.
The most important, firstly, is about leadership skill. Normal leadership is called collaborative leadership. The leader that can work together with the other people. I think because of now, the knowledge is a lot of knowledge in the world, so you cannot learn all of them. So you must have friends that keen or good at that point. So and you work together to create new things.
And the third one is work ethics, which is different from other professions. Because we like doctors have to work with patients' lives. It's vital that we have professionalism and like good attitude and behavior. I advise all of you to do research about our faculty first and ask yourself if you really like it, and then after you are sure about that, prepare yourself to be ready for the examination.
For a young student, I think that no matter what you want to be, you should just follow your heart. Like if you want to be a doctor, you need to study. Like you should know what the doctor will do, and you can decide like is it work for me or not. Because if you don't want to work with many people, I think that doctor may not be the right job for you.
And before one applies for medical school, I feel like they need to be very sincere to themselves, because many of the students come to med school just because their parents want them to be here. It takes a lot of effort being in the med school. Like, if you don't have your motivation in this subject, then you can like burn out very quickly.
Students should expose themselves to the field of medicine and the other field, so they should know themselves whether they like it or not. The medical life is like a cheerful life and intuitive life. My mainly is about take care and support medical students in Sirirat campus. We act like a wing beneath the wing of the medical student. We support them everything. We guide them. We are like a mentor for them. We let them relax, play sport and play music, and have like a extra curriculum that they can work together to prepare the collaborative skill that it is very important thing, and let them exercise about creativity by working.
It's good to see myself going forward in certain direction that could be helpful to people. I'm positive that in the next 3 years here, I should be able to do something for other people in distress.